and we have also discussed about preoperative assessment. We also discussed about preoperative assessment and different radiological factors. How do you assess with the radiograph, which includes OPG, occasional radiograph use? And we already discussed about war lines, white line, amber line, red line, and how to interpret in an OPG, and difficulty score index given by Anderson. And right now, we'll be dealing with the WARF assessment. Okay, fine. Everyone are ready? Fine. Am I audible to you all? Just respond, ma.
Yes, sir.
Sir,
Yeah, fine, fine. Yeah, fine. So now, before doing any impaction, the WARF assessment is very much important. While you're doing a PG, all the PGs before taking up the case, first they need to draw the war lines, they need to confirm with the staff, and they need to assess the WARF assessment. They have to do a WARF assessment. In WARF, every letter stands for something, right? So in W, see, in WARF, the first letter W stands for Winter's classification, W, and H stands for height of the mandible, and A stands for angulation of the third molar. Based on the angulation of the third molar, we are given a different varieties of scores, and at the last we just add it up, and we'll just find out the difficulty score index, whether the impaction is easy or it is moderate or it is difficult. So based on this assessment, we plan our surgeries. Okay. So we can tell the patient what's the duration of time has to be taken while operating, and what are the risk factors you can encounter. If it is a very difficult impaction, think that it is very close to the inferior ulnar now. So we need to take an extra care while sectioning of the tooth not to damage the neurovascular bundles. Fine. And R stands for the root pattern, F for follicles, and E for stands for the path of exit. How do you deliver out of the socket? How do you deliver the tooth out of the socket? So you know what's the Winters classification, what are the scores given. So based on WARF assessment, if it is an horizontal impaction, so the score is given as a 2. Whereas it's a distoangular impaction, the score is all given as a 2. And for the mesoangular, the score is 1, and vertical it is given as a 0. So very least difficult impaction is a vertical impaction. And coming to the second parameter, height of the mandible. Based on the height of the mandible, we assess the risk factors. So if the length of the height of the mandible is 1 to 30, so we are given a score 0. And if it is more than 31 to 34, the score is 1. And whereas 35 to 39, the score is 2. Okay. Can you see the values? Ma? Hello?
yes,
Yeah,
sir.
fine.
Sir.
Okay. So coming to the third parameter, see, this is the height of the mandible. Means if the height of the mandible increases, the depth of impacted tooth also increases. We need to go deep into the bone, and we need to trim a lot amount of. We need to trim a abundant amount of bone. So trimming a bone does it causes a lot of inflammation and swelling post-operatively. The less bone you drill, patient will be very comfortable. The more bone you drill, patient will have a swelling, inflammatory changes, very difficulty to open his mouth. So these are all the tissue factors, release of all inflammatory exudates, which might be somewhat discomfort to the patient. So it is always better to trim the bone to a minimal amount. Fine. So that's the second parameter. Comes under angulation of the third molar. The third parameter will be the angulation of the. How do the angulation differ? Coming to angulation of third molar. So if the angulation is in between 1 to 50 degrees, so the